All right, good morning, everyone. My name is Asara Clark. Welcome to today's real world testing webinar. I am going to give just a couple minutes for folks to get joined in here and connected to audio, and then we'll get started. So again, welcome. I'm Asara Clark with ONC, and we'll get started in just a minute or two. All right, guys. So again, good morning. This is Asara Clark here with ONC, specifically in the Division of Certification and Testing. I'm a senior advisor here and lead on real world testing. And so we'll be doing an overview today for health IT developers, as we know that real world testing deadlines are fast approaching. We will be posting the slides with this webinar on our website, the Real World Testing webpage at healthit.gov. So you will have access to the presentation and the slides for reference. Just so that you know, the past webinars that we have been posted there as well. And so you'll be able to go back and take a listen to, the webinar again via recording, and also have access to the slides. As far as questions, probably won't have time for questions, but the larger questions can be submitted to your ONC authorized certification body and or to ONC via our feedback system. And all of that information is included as far as the ONC feedback system and how to get in touch with ONC to submit an inquiry will also be included in the slide deck as well. So just a quick note before we hop into the information and get started. We just like to always include this disclaimer. The materials within this presentation are based upon provisions within ONC's HHS regulations. And so while we make every effort to hope to give some additional guardrails and additional context on what is in the provision, the regulation is the final law, and that is what you must go by. So we just want to make sure that you understand that it supersedes all within the slide deck that you will receive. All right, so let's go ahead and get started. I'm going to start off by just giving some basic background information on real world testing. I'm sure many of you already know a lot of what's in the first few slides, but we just want to make sure that we have an even playing field and that everyone's on the same page with the discussion as we dig deeper into developing real world testing plans. And so what is real world testing? Real world testing is a process by which health IT developers are able to demonstrate interoperability and data exchange functionality of their certified health IT in the real world environment that in which they're deployed or being used, also or their intended use, rather than in a controlled testing environment with an ONC authorized authorized testing laboratory, which you're very, very used to if you're certified under the program. You're used to going through the ONC authorized testing laboratory and ONC authorized certification body testing and certification process. Real world testing is to provide transparency into how your certified health IT actually functions when it's in the real world, when it's in the field, when it's being used in real use cases and real life scenarios. So it verifies that once deployed, it still does what it's supposed to do, and it still meets the intended functionality of the certification criteria. And we have touched upon in our regulations what real world testing means. And so we have here that certified health IT continues to be compliant with the certification criteria, including the required technical standards and vocabulary code sets that real world testing also means. Certified health IT is exchanging electronic health information in the care and practice settings for which it is marketed for use, and that the EHI is received by and used in the certified health IT. So this is really focused on data exchange, interoperability functionality, okay? Who's required to conduct real-world testing. It is a condition of certification requirement within which we have maintenance of certification requirements. So any health IT developer with health IT modules with one or more of the applicable certification criteria within the scope of their certification for real-world testing must meet this condition of certification, okay? And maintenance, as a maintenance of certification requirement, they must, health IT developers must submit a real-world testing plan to their ONC ACB by a date that the ONC ACB determines would allow them to make the plans publicly available on the Certified Health IT product list, the CHAPL. I'll refer to that as the CHAPL going forward by December 15th of each calendar year. Now, again, this is for transparency. So these plans will be posted on the CHAPL. Also, real-world testing results reports that must be submitted to the ONC authorized certification body by these health IT developer must be submitted at a time frame by a deadline that's determined by the ONC ACB in order for them to make the results report publicly available on CHAPL no later than March 15th of each year. I'll get more into the timelines and how this all works out briefly in the next few slides. But, you know, these are maintenance of certification requirements, as well as lastly, I'll cover here is the responsibility for health IT developers to notify their ONC ACB of any nonconformity with any certification program requirements that may arise during their real-world testing activities, okay? So health IT developers that have within the scope of their certifications within the program, the applicable real-world testing certification criteria must meet these conditions and maintenance of certification requirements. Now, the applicable real-world testing certification criteria you'll see here on this screen, and they're all of the interoperability and data exchange criteria. I'm not going to go through each one of them, but just, you know, notice here that it's care coordination, patient engagement, clinical quality measures, electronic exchange, application programming interfaces, and public health criteria. So again, you'll have this for your reference. All right. Now let's just talk a little bit about which modules should be included, because I'm sure that many health IT developers have, you know, may have multiple modules certified under the program. So again, you want to make sure that depending upon when you got your health IT module certified, that it is included in your real-world testing plan as appropriate. So the way that this works is all health IT modules with the applicable real-world testing certification criteria that have completed certification by or before August 31st of each year must include those health IT modules within the plan that would be addressed the following year of real-world testing, okay? So you'll see here on this timeline where we are addressing 2022 real-world testing. That's the first year that real-world testing is required. And so plans are due this year because you submit those plans in advance, right? And so any health IT modules that have the applicable certification criteria included within the scope of its certification that have completed certification by or before August 31st, a couple months ago, you know, of 2021, you should be working on or have maybe already developed a real-world testing plan for 2022. All right, so that is how this works. You know, so all of the health IT modules that, you know, completed certification by August 31st of 2021 should be included in your plan for you to conduct real-world testing next year, the year immediately following in the year 2022, and this continues every single year as a cycle. Now, when we talk about the life cycle, okay, we want to make sure that you understand that real-world testing occurs on a yearly cycle, but the planning, conducting, and reporting of real-world testing for each given year has a lot of activities that overlap, all right? So I go through this in depth from our, I believe it was March webinar on our website that's posted there, but just to give you a general idea of how this yearly cycle overlaps, as I just mentioned, all health IT that was certified as of August 31st of this year, 2021, must be included in your 2022 real-world testing plan. Now, when 2022 hits, After December 15th, that plan would have been posted on Chapel so that everybody knows how you plan to go out and conduct your real world testing in 2022. Calendar year 2022, you're going to be executing that plan all through the year 2022. However, when August 31st of 2022 rolls around, you're going to be planning for your real world testing that you will conduct in 2023, okay? And that plan will be due in 2022 when you're continuing to execute your plan that you submitted this year for 2022 real world testing. That plan is going to be submitted as you plan on how you're going to conduct real world testing in 2023. On top of that, okay, you're going to have to submit that plan while you're wrapping up your real world testing, while you're wrapping up the execution of your real world testing plan that you're submitting this year for 2022. Then you're going to have to submit results. So you're going to be planning for 2023 testing as you're wrapping up your real world testing for 2022 and generating your real world testing results report from 2022, which will be due to your ONC ACB in 2023 to be made available on Chapel no later than March 15th of 2023. So it's a rolling cycle where there's a lot of overlap, okay? And I go through this really in depth in the earlier webinar if you really need to get a more in-depth explanation. But today's webinar, we're going to focus more on the development of the plan itself. So I would want to go ahead and direct you there if you need additional information on that life cycle and the overlap. Now, we get an FAQ quite often where we have health IT developers wondering if they can submit a testing plan for the following calendar year for health IT modules that do complete certification after that August 31st deadline. So again, at a minimum, developers must include everything that's been certified as of August 31st. However, they are not prohibited from including in their real world testing for the immediately following calendar year certifications that have been certified after that August 31st deadline. Keep in mind that it's not required, but you can do so. You may have reasons why you want to, include those to help to, build up the transparency within your health IT module, to help, give a full scope of, what the capabilities are. That's totally fine. Developers that choose to do so should understand that it's going to continue in the next cycle of real world testing as all other health IT that are still actively certified under the program, okay? So this is just something that we've been asked. So we like to go ahead and cover it here so that you're not prohibited from doing so, but just keep in mind, you must include all health IT modules certified to the applicable real world testing criteria as of August 31st of each year. All right, so that was the background information on the requirement itself, timeline and that kind of thing, but we're going to really focus today's discussion on designing and submitting a real world testing plan, because I know that many of you are in the process of doing that right now. So let's go ahead and jump into it. All right, I want to first point your attention to a template that ONC put out. It's an optional template that's been made available to health IT developers as they create their real world testing plans. It outlines all of the required elements. It is intended to help you to organize the information that is required in your plan to help you flesh out how you're going to approach real world testing. Again, it's optional. And so you don't have to use it, but it's a really great guideline for how you might organize and structure your real world testing plan for submission to your ONC ACB. Always note that ONC ACBs may have additional requirements for submission, so you just want to confirm all requirements with your specific ONC ACB as you work with them to submit your real world testing plan for being made publicly available in December of this year. All right, another timeline, because we just understand, how many moving parts there are here with real world testing plans and results reporting and deadlines. So this just recaps again, real world testing plans have to be submitted to the ACB and be made publicly available on Chapel no later than December 15th of each year. That's the maintenance of certification requirement. And then the real world testing results must be submitted to your ONC ACB in order to be made publicly available on Chapel no later than March 15th of each year. And again, I went through, how those roll out for the applicable calendar years of real world testing. For both testing plans and results, ONC ACBs will determine the date by which the plans and results must be submitted, because they have a responsibility of making sure that they've been made publicly available on Chapel. All right, so this just gives a little bit of a diagram image of how this works and how the ONC ACB specific deadline is going to fall somewhere in between the August 31st deadline for certifications and the December 15th deadline for those to be made publicly available on Chapel. Keep in mind that they have to conduct a completeness check to ensure that all of the required elements are included within your plan. So you're not going to be asked to submit your plan on December 15th because that is the date that they have to be publicly available. Okay, so just make sure that you understand your ONC ACB requirements and work with them closely for ensuring that you are able to meet these conditions and maintenance of certification requirements. All right, now, as I've been talking about the elements that should go into the plan, so I'm going to start to dig into these a little bit. Each plan is required by regulation that you include specific elements. Those elements appear here on this slide. You have to choose your testing methodology. You have to include standards updates, associated certification criteria within the scope of your certification, description of the measurement metrics that you're going to use, the care setting types that you're going to be addressing, a justification for your real-world testing approach, your expected outcomes from real-world testing, and the key milestones that you have for real-world testing. All right. So let me just get into when we talk about your testing methodologies here for real world testing, just keep in mind that the developer is best positioned to determine the processes and the procedures for working with their customers for those live observations of those health IT modules functionality in a production environment. And you must describe the testing and or measurement methodologies that you plan to use in your real world testing activities, okay? So we have some factors here that include but are not limited to, for your consideration, the size of the organizations that production systems support, the types of organizations and settings that you're working with for your certified health IT modules, the number of patient records and users on them, system components and integrations, volume and types of data exchange, certification criteria measured individually or concurrently, and health IT modules addressed individually or concurrently. Okay, so these are some factors that you want to think about when you think about the methods that you're going to use for your real world testing approach. We get a lot of questions about, do you have to have one plan or many plans? You have full flexibility in how you want to address real world testing within your real world testing plan. So if you choose to do one plan that addresses all of the applicable real world testing certification criteria, you can do so, or you can break that out into many plans, totally up to you. And then just to touch upon the testing environments really quickly, we want to just keep in mind that the purpose of real world testing is to demonstrate that health IT modules continue to perform in conformance with their certification as they are deployed in production. So the real patient data and real production environment should be first considered when developing your real world testing plans. Is very important, because otherwise you kind of go against the spirit of real world testing, right? So you want to make sure that you're considering real patient data, real production environments. Developers are discouraged from using test tools and platforms as real world testing processes. It deviates from the underlying goal of real world testing being conducted in and specific to intended use cases and setting type in which the certified health IT is marketed. So just avoid those things, guys, when you're planning, and make sure that you're considering the general purpose and spirit behind real world testing and why we're having, why this requirement has been put into place. Is to take it out of the evaluation of functionality and capabilities out of the controlled testing environment into the real world to make sure that your product is still operating as intended by its certification. All right. Now we have an FAQ that talks about modified approaches, because we get this question a lot as well, where developer wants to know if they submit their plan, but once they've begun their real world testing activities, their approach doesn't seem to fit the needs to successfully demonstrate real world testing, to successfully demonstrate functionality in a real world testing environment. in a real world environment. My apologies. And so we've had developers who want to know if they're allowed to stray from the plan they submitted. Like, are they bound to that plan, and do they need to modify a plan and submit a new plan? And so the answer to this question is yes, you can modify your approaches. Okay, we understand that as you get into your real world testing activities, into the calendar year of real world testing, that there may be some approaches that you planned on taking that once you get into it, you find that there could be a more, a different way that you could, tweak your approach. And so we don't prohibit you from doing that. We want you to do what you, feel is best and for you meeting the real world testing requirement and demonstrating that functionality. However, we're not going to update plans on the chapel. So the plan that you put on the chapel is going to be the plan that's there. You want to work with your ONC ACB to let them know that you're going to adjust some of your approaches. And you want to work with them to, make sure that when you submit your real world testing results report, that you cover these changes that you made, the types of changes that they were, the reasons that you made the changes, and how the intended outcomes were more efficiently met as a result of these changes. So these changes would not be submitted in an updated real world testing plan. They would be incorporated into your real world testing report for you to cover everything that happened throughout your real world testing, because that is what the results report is intended for. So just check with your ONC ACB for any additional considerations when handling these types of adjustments. They may have something in place to help you manage this kind of stuff. But again, you're not prohibited from doing so, just not going to be posting updated plans on the chapel. All right, so when you're submitting a real world testing plan, you're going to have to include standards updates. We covered in the webinar earlier this year, we went a little bit more into depth of what these standards updates are about. But here I want to talk about how you incorporate these standards updates into your real world testing plan, and how to ensure that you have, you're meeting the requirements to account for these standards updates in your real world testing activities. So the ONC Cures Act final rule does require developers to update their certified health IT modules to new standards for specific certification criteria. These updates that have been made prior to the August 31st deadline will have to be included in the next year of real world testing. Keep in mind that there are overall deadlines for when these updates must be completed. But until you get there, if you have done these updates, made these updates to your certified health IT prior to August 31st, let's use this year as an example, any standards updates that you completed prior to August 31st of 2021, those must be included in your 2022 real world testing plan. All right, so how you want to ensure that your certified health IT is updated, you want to review the 2015, it's updated to the required standards updates for specific certification criteria. You want to review the 2015 edition Cures Act for relevant criteria updates and associated timelines. I have a slide here for your reference in this slide deck as well that gives you those timelines and deadlines for the specific criteria and standards. Work with your ONC ACB to ensure all updates to selected criteria cover the full scope of your certification so that there's nothing being left out, and notify your customers of updates to respective products. Once updates are complete, your ONC ACB will update the product on status on Chapel. So there's requirements for you to, report to your customers, report to your ONC ACB, and then you're going to account for these updates in your real world testing plan and when you conduct real world testing for the year for which that plan addresses your approaches to real world testing. So you don't do these updates and take them back to your ONC ACB or ONC ATL to further assess or evaluate functionality after the updates have been made. You're going to include these in your real world testing plan, and you're going to go out and test that functionality within your real world testing activities. So here are the standards updates for your reference. I'm not going to go through every one of them, but here are the updates with the applicable criteria that they will, must address, and the deadlines by which you have to have made these updates. All right, now we have another process by which health IT developers can incorporate standards updates in their certified health IT modules. And this is the standards version advancement process. Now, with the standards version advancement process, this is a voluntary process that allows health IT developers to update their certified health IT modules to more advanced versions of standards and implementation specifications and versions that have been incorporated by reference in the regulation. Okay, so this process is completely voluntary and it's only applicable and available for ONC approved newer versions of adopted standards. So you want to just make sure you have the website here. You want to make sure you follow the ONC approved newer versions of standards that we've adopted and incorporated by reference into the regulations to, make sure that you're up to speed and up to date on, which newer versions are allowed within the program. And these updates are also going to be accounted for in real world testing. Okay, so you can choose to update to these newer versions. We do get an FAQ that it seems like folks are a little bit confused about the relationship between SVAP and real world testing, where, folks want to know if they want to update to a newer approved standard via SVAP, is that accomplished through real world testing activities? And the answer to that is that the real world testing is not the process by which you update, okay? It's not the method for using or for leveraging or taking advantage of the SVAP flexibility. It's just an activity where you demonstrate conformance once you've actually included these updates to the newer versions of the ONC approved standards within your certified health IT. So we just want to clarify that real world testing does not serve as the update method for SVAP, but it serves as a way for you to demonstrate conformance once you have made those updates, okay? So I mentioned some of the requirements for when you're using and leveraging the SVAP flexibility. You have to provide advance notice to all affected customers and your ONC authorized certification body. That notice must include your intent to update to the more advanced version of the standard, expectations for how the update will affect interoperability of each affected health IT module, and whether or not you intend to continue to support the certificates for the existing certified health IT modules in the version of the standard that it was certified to. Okay, you have to successfully demonstrate conformance with approved more recent versions of the standards included in each updated certification criteria via real world testing. And work with your ONC ACB to update all information included in that chapel listing, okay? So you maintain the updated certified health IT in full conformance with all applicable certification program requirements. So you must, make sure that you're able to demonstrate that as you're planning to assess your real world use of the updated certified health IT modules within the program, okay? So this is to cover the SVAP. And just as a wrap up for standards updates, the following should be submitted for each standard included in the developer's real world testing plan. Because remember, today we're wanting to make sure that we are helping you to compile this information, helping you to include all of the necessary elements. And so the template, you'll notice if you decide to use the optional template that we put out there, will have all of these check marks that you see here on this slide included as information to include regarding your standards updates. That's going to be the standard and the version. That's going to be the certification criteria in which product has been updated. It's going to be, if reporting on multiple products, identify the certification criteria that were affected by the update for each of the associated products, the chapel ID for each health IT module, method used for standards update. Again, I just talked about required standards updates for certain certification criteria, and then I talked about a voluntary flexibility that we have out there. So you would want to, articulate within your plan what kind of standard update this is, the date you sent the notification to your ACB, for SVAP only the date that you sent the notification to your customers, measure used to demonstrate conformance with the updated standards, to tie all that together, and then which certification criteria were updated to USCDI and or to which version of USCDI was the certification criteria updated. So you'll notice that this is all in the template. And again, this is to help you to really organize the information in a way that helps your ACD see that all of the required elements are there and included in your plan, and that you have covered everything that they would need to know to be able to verify that you have included all of the required information by the plan elements, as well as for each individual, each specific standards update that you're going to be going out to real world tests to conduct real world testing the following year. All right, now we're going to get into identifying measures, okay? I want to first and foremost say developers have full flexibility in selecting the measures that they will use in their real-world testing approach. ONC will not and is not pre-approving measures, okay? So we want you to be very, very flexible in your thinking and your approaches. We reiterate this because the developer is best positioned to understand how they might work with their customers to measure their real-world testing activities and that functionality, and those capabilities in a real-world environment. So you want to be thinking about when you're deciding how you're going to measure conformity to the data exchange and interoperability certification criteria, because that's where we focus our real-world testing. You want to be thinking about what sets you apart, what you want to highlight about your certified health IT module as far as how it meets the requirements. You want to keep in mind every real-world testing plan must have a minimum of one measure, okay? If you have multiple certification criteria require real-world testing, you may have one measure that covers them all, okay, but there has to be a minimum of one. Each applicable certification criteria must be addressed in a measurement or metric. So developers with multiple certified health IT modules or products certified to multiple certification criteria could have more than one measure, okay? So just keep in mind that you add that flexibility. Each type of care setting in which their certified health IT is marketed must be addressed, okay? So you don't have to conduct real-world testing in each care setting, but each care setting type, okay, excuse me. So keep that in mind when you're identifying measures that you'd like to use. Measurements and metrics can be combined in many ways to yield results. So again, one measure could potentially address multiple criteria and or care setting types. And then measurements and metrics should demonstrate ongoing and interoperability and functionality related to the specific relative to the specific certification criteria. So just keep in mind that real world testing and demonstration, and when you're thinking about these measures, you want to measure over time, okay? So we'll talk a little bit more about, examples, but you'll see here on this slide here, but when you're identifying your measures, you want to think about the fact that, real world testing is conducted over the course of an entire year. You determine how you break out, the different activities of your real world testing throughout that calendar year. But there are some favorable factors and unfavorable factors that ONC has put out there as far as, what you should include and to steer clear of when you're thinking about the type of data and collection methods for when you're identifying these measures. So again, real patient data, the rate of success failure, number of errors compared to successes over time. When we're thinking about types of data, unfavorable factors would be a yes, no response or a pass fail response, or, the use of a tool as a proxy measure. These things are, these types of approaches don't necessarily demonstrate real world testing over time. We get a lot of questions around percentages and benchmarks and pass fail and can they be used? And the bottom line is it's not likely that if those types of measures are the sole response in your results report, that they would really demonstrate real world testing and how well your health IT module meets the applicable certification criteria over time. You just can't have one big pass. You have to describe how you got to this benchmark, or how you got to this percentage, or how you got to, to come to the conclusion that your product or your health IT module meets the interoperability and data exchange capabilities and requirements of its certification. and it can't just be it did it. Okay, so that's kind of what the spirit behind what we're putting out here. That's, again, we're not pre-approving, but we want you to be thinking about this because your ACBs have to do a completeness check. And if they push back a little bit on a yes/no measure, this is why, because that does not demonstrate over time how you measure, the functionality of your health IT to say that you had successful real world testing. All right, and even with the collection method, the data derived from networks that developers participate in, data derived from use of test tools, yes, you can use that data, but surveillance results indicating conformity, nonconformity, or a single instance of demonstrating interoperability or data exchange, again, do not demonstrate over the course of the real world testing year that how you got to where you're saying that you meet the functionality and that your product is still conformant after it has been deployed and is being used in a real world environment. So this is just something that we like to be sure we go over here just to make sure that you kind of have within your approaches and thinking, what you should steer clear of and what you, which direction you want to be thinking in as far as what would be, a measure that could truly be effective at demonstrating real world testing. All right, now we also have special scenarios that we know that, health IT developers run into. Certain scenarios specific to your health IT may inform what measures you select to include in your real world testing plan. So we understand that there are resellers of certified products out there. We understand that there's third-party relied upon software incorporated into some of your certifications for your health IT modules. We understand that you have cloud-based products that you may have questions about and products with non-deployed capabilities. So I'm going to run through these. All right. So with the relied upon software or third-party software, okay, if you have this incorporated into your certified health IT module certification, then you know that ONC does allow for health IT developers to utilize third-party software to rely upon for capabilities to include within their certified health IT modules certification. And so when you use third-party software to demonstrate conformity with certification criteria, you have to keep in mind that is how your the certification decision for your health IT module was made based upon your use of these additional capabilities that come through a third-party software. And so when you're thinking about your real-world testing, obviously you have to also include that in your real-world testing because that is what your certification is based upon, okay? So, on Chapel, your third-party relied upon software is listed there as an inclusion of your certificate. And so you should also be sure to consider how you're going to incorporate it into and with your real-world testing. So the same way you worked with that third-party to achieve certification under the program, you're going to have to go back and work with them on how you're going to approach your real world testing activities and to be sure that they're included. So just know that if you have a certification that includes third-party relied upon software, that your ONC ACD is going to be looking for how that's going to be incorporated into your plan. We also have cloud-based products where you might have a cloud-based product that offer the same deployed capability across multiple types of care settings. Those will be required to be tested in each of the care setting types, okay? So even if it's a cloud-based that services multiple care setting types, you still have to cover those different care setting types in your real-world testing plan, all right? Okay, now resellers of certified products, we know that ONC allows for you to work with resellers and have business relationships where you allow for your products to be sold by other parties. And so developers are responsible for communicating the real world testing requirements to your remarketed products, partners and distributors, okay? Because if it's on Chapel and it's being represented on Chapel as a certified product, it has to, in order to maintain its certification and as a condition of certification, meet these real world testing requirements. So ONC does not specify whether a reseller or the original developer is required to fulfill real world testing. Totally up to you to work with your partners and your distributors, okay? We do allow and permit for inheritance of plans and results reports But keep in mind that you want to make sure you understand the setting types in which your resellers and distributors are marketing your product, okay, your certified health IT, because you may have your care setting type covered. But if your reseller or distributor has another care setting type in which they market, you have to work with them on how to ensure that care setting type is covered, okay? And so this is totally, again, the developers have full flexibility on how they want to approach this. Check with your ONC ACB for any additional requirements around reseller reporting, or if they have any kind of ways of, to assist in making sure that you have everything covered. But again, if it's on Chapel, being represented as a certified health IT, it has to meet all of these requirements, okay? So just work with your resellers and distributors, make sure they understand the requirements, and make sure that you are having all care setting types covered. If there are any outside of what you currently, in the types of care settings that you market your certified health IT, make sure your resellers and distributors also don't have any additional care setting types that need to be covered as well, and that they understand that depending upon whatever your arrangement is with them, that they may be required to go out and meet these real world testing requirements on their own, or must work with you to be sure that happens for them to maintain certification and to meet these real world testing requirements. All right, now this slide, we're going to talk about products with non-deployed capabilities. And I'm going to spend a little bit of time on this slide because we get a lot of questions about this where, we understand that there are instances where capabilities, a health IT module that's been certified has several capabilities, multiple capabilities, all of which have not been deployed or used by your customers, okay? These capabilities must still be addressed in your real world testing plan. You still have to think about how you would go out in a real world environment or use case or scenario and test the capabilities, whether they've been deployed or not. Essentially, if it's included within the scope of certification, it's going to be represented on Chapel, and this is a certified health IT module, and it's part of that module, and you have to still account for those capabilities, and you want to just leverage your flexibility here. Work with your customers. You have full flexibility to work with your customers or your potential customers. You may have prospective customers out there that you can help them understand the value of real world testing, help them understand how this really truly, helps you to provide that transparency into the capabilities of your certified health IT modules, and work with them and be flexible to really figure out, the scenarios, use cases, workflows, and for day-to-day activities where you can go out and really still, whether deployed or not, get your foot in the door with your customers or prospective customers to demonstrate that these capabilities work when, in the real world environment. You have to do your due diligence at taking the steps to at least go about utilizing real patient data, testing in a real world environment. But we do understand that in some instances, if you have done all you can and you cannot, seem to get into a place where you do have, real patient data available to you, or a real, scenario, use case environment where you can conduct your real world testing activities, that you may have to combine synthetic patient data, simulated test scenarios. The point of the matter is, start out with your approach with trying to get into like a real life situation. But if you don't have, real patient data to use, if you don't have a real live scenario where you could go into a real world testing environment, then you want to still do your due diligence to come up with synthetic data with, simulated environments to just be able to meet the requirements of the real world testing condition and maintenance and certification, because you have to, definitely report on, your efforts here. So it's an opportunity for you to partner with prospective customers or customers that you already have working relationships with. But the bottom line is it can't be left out. You know, you have to include these capabilities within your real world testing plan. You have to do your due diligence to try to conduct the real world testing activities that you include and execute on that plan. And if all else fails and you're not able to, you know, get into, you know, conduct the real world testing, you have to report on that. And that report should not just say, you know, your results report to your ONC ACB, we tried, but it didn't work. You're going to be expected to detail how and what you did in order to, you know, really do your due diligence to try to demonstrate how these capabilities will function in the real world. All right, just utilize your flexibility, but just know that these cannot be left out or excluded from your plan nor your results reporting, because these capabilities are not yet deployed or being used by your customers. All right, so when designing your real world testing plan, guys, we're going to just go and cover each of the elements really quickly. So for your measure description, just remember, I talked a little bit about, you know, percentages and benchmarks and pass fail. You want to describe how you get there. Okay, we're not saying don't, you know, include these things at all. We're saying those should not be the sole measure for how or description of how you're meeting, you know, how you're going to measure the functionality when you're conducting real world testing. All right, so you want to describe the measure, the metric or data collected, time period of the measurement, associated certification criteria, justification and expected outcomes. All of these things help for you to be able to describe how you're actually going to go out here and measure success of these evaluations. You want to consider how the data, metrics, and measurements will work together to produce the evidence needed to demonstrate successful interoperability and functionality. So just remember, you know, we're not saying, we're not telling you what to do. We're just telling you, you have to describe what you're going to do and how you're going to get to where you're going to get to, okay? Also keep in mind that you have to have a justification for your measuring approach. So provide the rationale or justification for how the measure will successfully demonstrate interoperability and functionality for the specific certification criteria, health IT modules, and or indicated care setting types. Demonstrate how the measure is relevant to the overall strategy in meeting real world testing, condition and maintenance and certification requirements. And then the associated certification criteria, you want to be sure to articulate the certification criteria addressed in each measure. Okay, so the measure you have to be specific about which certification criteria that within the scope of your certification the measure is addressing. If you're using a single measure for multiple health IT modules, you want to clearly identify that. And ONC recommends an inventory of measures, certification criteria, and associated modules be included in plans results reports for easier ACB completeness review. So this is why we developed the template guides to help organize this information in a way that makes it easy for everything to be accounted for and for the ACBs to identify those specific elements. Now, as far as care settings, we want to just go over a few things really quickly. You know, keep in mind, you don't have to real world test and conduct real world testing in every single care setting, just every single care setting type. Okay, you have to include a justification for the care setting types that you choose to say this is why you chose this particular care setting type in which your certified health IT is marketed. And we have some considerations here for, you know, choosing your care setting types. So one is going to be settings or healthcare provider types are not excluded from real world testing based upon eligibility or ineligibility for any other federal healthcare programs or initiatives. So just know that you have to cover them all, no matter what or no matter what the eligibility is for other programs. These are conditions and maintenance and certification requirements. So these are requirements for you to be certified under the ONC Health IT certification program. A real world testing plan is not required for each individual product or each individual care setting location. So just keep in mind that you can incorporate, you know, each care setting type into one plan or multiple plans, whatever you decide. Health IT developers may bundle products by care setting criteria, et cetera, and design one plan to address each, or they may submit a combination of or multiple plans that collectively address your products and their care setting types, the care setting types in which they're marketed. And then health IT developers should construct real-world testing scenarios and use cases that test more than one care setting applicable to the health IT module. So you just want to make sure that your care setting types are covered, okay? You want to make sure that every care setting type in which you market your health IT, you're able to demonstrate how your health IT module is functioning in those real world scenarios and use cases. And you just want to make sure that your plan specifically articulates which those are going to be, all right? And we have an FAQ because we have developers that really want to know what they should choose, or how granular they may need to get with the care setting types. They want to know if they can use certain care setting types. And we do not, specify this. ONC did not specifically define or limit the care setting types. And we really leave it to the health IT developer to determine, the types of care settings in which you market your health IT. We do give some examples here where you may consider certain categories. These are not limited to this list, but we have those that are included in the promoting interoperability programs. And so, the link is here, and when these slides go out, you'll be able to, access that, or you can, access them on your own. We have long-term and post-acute care, pediatrics, behavioral health, small, rural, and underserved settings. There are all kinds of setting types that you could consider, and you just want to just really think about what's specific to your health IT module, and what care setting types you market your certified health IT. All right, now when talking about expected outcomes, guys, you just really want to, describe what should be the results of your real-world testing approach, okay? Health IT developers should detail how the approach is chosen will produce outcomes that reflect successful real-world testing. We want you to provide transparency into what, current and potential customers will know about your certified health IT. So when they take a look at your plan, or if anyone takes a look at your plan, they should kind of know, okay, well, these are the things that should be a result of, their real-world testing approaches, and this is what I'll know about this product. You also want to reflect you can reflect what should not be a result of a given action during real-world testing activities. You want your expected outcomes to be measurable, and indicate the level at which your certified health IT modules are providing optimal user experience for your customers and other stakeholders. All right. Now, when it comes to when it comes to key milestones, this is basically a timeline for the steps that you're going to take in your real-world testing activities. Okay. You want to include different key milestones that are going to occur, throughout your real-world testing calendar year, and how those are going to roll out. What different activities and steps are you going to take to execute your plan? And some sample milestones may include development of candidate list of providers to assist with real-world testing, development of software, which could be used to gather data for analysis, finalization of real-world testing plan and submission to ONC ACB per ONC ACB instruction, collection of information as laid out by the plan for the period, validation of expected outcomes, completion of test suites, cycle of testing, begin and end dates, completion of testing phases, the end of real-world testing period, final collection of all data, analysis and report creation. I mean, these are just some samples, some different ideas on how you might think about different steps within your real-world testing activities, and how you're going to articulate those key milestones within your plan. I mentioned earlier on in the presentation that if you run into a situation where a nonconformity, is discovered during real-world testing. And this is the point of this, right? You're going out to conduct real-world testing to make sure that, your certified health IT module functions as, intended in a real world. And so we totally get that you might run into a situation where that functionality doesn't perform as you intended. If this occurs, you just want to work with your ONC ACB, as they have processes in place to help you, for self-reporting of nonconformities, and to help you to address whatever the nonconformity is. So just familiarize yourself with your ONC ACB's process for self-reporting nonconformities. communicate the finding within 30 days as required by 405(b)(2) Roman numeral 1, and work with your ACB to develop a plan to address it. This is just where, this is not outside of, normal reporting practices. And so we want you to take the same approaches when you're conducting real world testing if you find any lack in functionality throughout. So just want to, before we wrap up, point you guys to, other real world testing resources outside of today's webinar and the slides that are going to be posted. We recently in August put out a real world testing resource guide. It aims to assist developers in organizing the required elements related to the submission of your real world testing plans to support the condition and maintenance certification requirements for your applicable health IT modules. So we provide clarifications on timeline requirements, details on plan elements needed to meet requirements, guidance on special considerations for unique products, customers, and/or settings. And we also have some sample scenarios to illustrate the creation of a real-world testing plan to support testing for health IT modules that must complete real-world testing for a single criterion, and then health IT modules that must complete real-world testing for multiple certification criteria. So there's some use cases in there that you want to look at. It. This is to help you, in your thinking about how you want to approach real-world testing. It's not to be, mirrored in any way. It's really to sort of, help you understand the thinking behind making sure that you address real-world testing in a way that will assist you in, demonstrating successful real-world testing of your certified health IT module. We also have a fact sheet out there that we put out back in February of this year. It's a high-level overview of what real-world testing means for you as a health IT developer, the requirements and everything, making sure that you're meeting real-world testing requirements. If you have the applicable criteria within the scope of your certification. Again, we have the real-world testing plan template that I covered earlier on in this presentation. We have the resource guide. We have real world testing companion guide out that you want to take a look at if you have not taken a look at it, and then previous webinar recordings in addition to this one with the slides. So just keep in mind the two that we had one mid-September. We're having this one today. It was the same information. Obviously, we're going to still, post both recordings. The slides will be the same, for both, because as we noted in the announcements, this is going to cover the same information. But, we want to continue to hear from you. We want to continue to hear from you, any questions that you have, because we plan to continue to put out additional resources as time goes by. As we receive more information from what you're experiencing in developing your plans, what you're experiencing as you conduct your real world testing activities and go out and execute those plans, and as you start to report on your results that you have, that you're going to report to your ACB and be made public and make them public as well. We want to hear from you on all of that so that we can continue to roll out, information, resources, and do these types of webinars to continue to help you meet these real world testing conditions and maintenance of certification requirements. So guys, that wraps up our presentation for today. Thank you so much for joining the real world testing webinar this morning. We hope you got a lot from it. These will be posted again, as I mentioned earlier, and we definitely appreciate your time and input. So everybody is free to disconnect. Thank you so much, and thank you for your time today.